Surgeon and Johns Hopkins professor Marty Makary criticized Dr. Fauci's lack of research conducted during the pandemic and how it has sparked new issues in America. Let's watch.
If you don't know the facts, do the research. He had a budget of $45 billion, 20,000 employees, and they couldn't even tell us how coronavirus spread. They were telling everyone to wash their hands like crazy for the first 4.5 months, from January until mid-April. They didn't even know it was airborne. How long would it take to do that experiment in the lab? It would take less than 24 hours. When you have that kind of budget and resources, don't dangle these open opinions and theories in the public domain. Do the research. That's all we needed. We never saw research on natural immunity, how it spread, how selective it is in children. In children, it's those with special medical conditions. It's not healthy children. So when you don't know that, when it's a research unknown and you're not funding research to look at it, you have an indiscriminate blanket policy that ignites a mental health crisis, results in tens of thousands of lost lives, lifelong learning loss, and children who are forever lost to the school system.
Podcaster Joe Rogan said that a lesson learned from the pandemic is to, quote, vote Republican. Let's take a listen.
No one who is alive today had ever experienced a true pandemic. And I'm hoping that now that this is over, people are going to, recognize that some serious errors were made and not repeat those. That's the best you can get out of it.
So what do you tell those people?
Vote Republican. That's what a lot of them are going to do anyway.
Yeah?
Yeah. Oh, yeah. I mean, more than 1 million people transferred over to the Republican Party, I think in 2021 alone. Find out what that number is. But, you look at guys like Ron DeSantis, who kept Florida open and had some pretty reasonable policies in terms of, like, what to do about COVID. And, he mapped it out on television. He was, widely criticized for this, where he was saying, like, we need to protect our elders. We need to, make sure that medical care is available for those people, and everyone else, you should be able to do whatever you want to do.
Of course, Florida has the second highest COVID death rate by statistics. Look, it's frustrating because I certainly have no interest in defending the Democratic Party, but the lockdowns did happen under Donald Trump, and it's a weird kind of a memory holding that's happening here.
Yeah, look, I agree with that. I mean, the funny thing is, Dr. Fauci worked for Trump for the beginning of this pandemic. We've kind of memory hold that, like, Trump wants to pretend that I set that guy straight. No, you did everything he told you to do. Yeah. Then you maybe undermined him some ways, undercut him, but you basically did. We basically did exactly what they wanted for the end of the Trump year. I'm also not sure it's fair criticism from the guy that was being interviewed on Fox who was saying that the research wasn't being done. I mean, research was being done. It's that the dictates from the public health people were very slow to catch up with research, I would say.
They knew it was airborne. I mean, part of the disclosure was that they knew, was it January or February, that the disease was airborne, but there were all kinds of reasons why they didn't want people to go out and, for example, buy up all the masks that the people in hospitals and who were primary caregivers needed to wear. It was a misinformation that I think wasn't driven by ignorance in large part, although there was a period of time where people didn't know. I also think that he overstated the ease of which you can ethically do the kinds of studies he described.
Well, ethical is the question, because I remember being frustrated. Remember when we all learned that actually the genome of COVID or whatever it is it was shared and known, and they had quite literally manufactured. They could produce the literal vaccine 24 hours later. But then it took months, and this is something we all learned, but then it takes months and months and months for testing, for trial, to make sure it's not dangerous, but they have it. Meanwhile, thousands of people are dying, and it took faster than it's ever taken before, and maybe that's the fastest it can take, but there's a frustration that the government's not going to let people take it. And they're dying by the thousands.
And on the flip side, there have been innumerable vaccines and other kinds of medical technologies that have caused an enormous amount of pain and death in the United States. Thalidomide, Dalcon Shields.
Right. What was the one for pregnant women?
Thalidomide, where all of these kids were born without limbs because, sometimes even if you do test, you get things wrong. Yeah. So, that is a legitimate cost benefit for people to have to do. But I don't think anyone is suggesting that you just throw someone with COVID in a room with someone else with COVID and see if they catch this disease disease that no one.
Well, and you can't. You can't do that because of ethical But I'm one of those people who think that human challenge trials would have been perfectly ethical if everyone consents to do it. That the government should not stop people from consenting to do things if they're willing to do it. But you could have had a faster. I mean, animals, we do testing on animals. Animals cannot consent to be tested on. People can.
Yeah, I agree. And a lot of animal rights activists have a lot of thoughts and feelings about them.
They're right. I don't mean to sound like a lefty or something, but
are we vegan now, Robby?
I'm not vegan. I am not vegan.
Okay.
But no, the animals cannot. This is an important philosophical point. The animals cannot consent to be tested on because they're animals. People, a healthy human being, could say, yeah, I'll participate in this for payment.
Yeah, I mean the problem is that,
and find out what happens. And if they're willing to do that, it's not unethical if they're willing to do that.
Right. And I'm not saying anything one way or the other.
Scientists are like, oh no, we can't be.
But
we're not Dr. Frankenstein. We refuse.
The argument is that people have a hard time evaluating risks. So the idea that people are being compensated fairly to assume an amount of risk is out of.
So do epidemiologists.
What's out of step with what social psychologists and sociologists understand. Yeah. Humans' own perception. That's part of why we have things like Social Security, because as much as we know that we're supposed to save a certain amount for retirement, an emergency comes up and people value the short term over the longer term. And I think that a lot of people who sign up for these kinds of things, people who say, okay, it's fine for you to pay me $20,000 for my kidney, feel differently a little bit down the line.
Yeah, but the people setting the rules is saying you're not allowed to take on that risk, but the people saying, yeah, I'll never get a haircut again. It won't ever be safe in my life.
I don't think that's necessarily fair to complain.
That's what they said. They're more risk averse than any aspect of our society. I don't know. All right, going back to what you said, Briahna, per 100,000 people, Mississippi, Arizona, Oklahoma, Alabama, West Virginia, and New Mexico actually had the highest death rates. Overall, California, Texas, Florida, and New York, they have the highest death rates overall. So I guess it's per capita versus overall. Yeah. Florida also has a very old population. They have
fair enough,
where people go to retire.
I do think that there's this way that we talk about COVID only affecting or disproportionately affecting older people or disproportionately affecting the immunocompromised, like those lives don't matter. And if you were someone who is 70 who was going to live 10 more years or so, a lot of our parents are in that age range, and I certainly wouldn't think it was immaterial that there was a disease that could have been, addressed in a more comprehensive way that would have saved those kinds of lives.
No, but that goes the other way too, because if you're a grandparent and you're 85 or something, I mean you have hopefully a very long time, but your time with your kids, with your grandkids is you don't have necessarily so many good years left. And if you're going to spend all of those good years, you're not being allowed to see people or being aggressively restricted.
Not being allowed to see. We mandated that people couldn't see their grandkids.
No. Well, we did at the beginning. The UK did.
It was a suggestion that you social distance and not see people. But the police
didn't do that.
Separating Tiny Tim from Grandma Jane in the front yard.
Yeah.
I mean, I think it's just important that we remember how we talk about this. In the beginning, a lot of us voluntarily took on behaviors because we thought and were told by the medical establishment that was the right thing to do. I think some of that was right, particularly before we got vaccines. And a lot of older people were dying at quite high numbers. What I'm saying is some
older folks might say, now we have the vaccines, they got vaccinated, they have some reasonable protection. They might say, look, I don't want to miss out on social opportunities with my family because I don't necessarily have that much time left anyway, and that's not a crazy calculation, taking some risk at that age for more enjoyment in the remaining time you have rather than always delaying any risk.
So you're talking about people being able to make individual choices, which they always have been able to do with respect to seeing who they want to see in free association. And what I'm talking about is whether or not we are drafting COVID policy and implementing COVID policy on the basis of treating some lives as dispensable, which is what happened with a lot of the policies around nursing homes in New York that resulted in so many people dying, and which arguably is happening around some of these public policies around masking, where people from the disability community have been very frustrated at that. They're basically being told that you have to either completely quarantine in your own home or risk very serious health outcomes just because they are somewhat outside of the norm in terms of how how vulnerable they are.
Okay, so here's what I meant. For instance, like my grandparents lived in a retirement community in Florida that they're still active. They're involved. There's a community events. There's things going on. They read plays. They do things. And then when COVID hit, that all shut down, and they're mostly just they live comfortably. They had a home. It's very nice. But all the community and social things that they enjoy doing, were shut down just like for the rest of us, and then never came back. And so they left that community. They moved to be closer to family because they're older and they value the time. They've said they're vaccinated. They said, if the Lord takes us, we don't want to spend what time we have under house arrest and not being able to socialize at all. So that's the kind of thing I mean. Mm-hmm. So. Well, before we go, yesterday, journalist Peter Doocy questioned White House Press Secretary Karine Jean-Pierre on COVID and tennis.
How come migrants are allowed to come into this country unvaccinated, but world-class tennis players are not?
You're talking about which world-class tennis player?
Novak Djokovic.
So, as far, just since you asked me about him. So, visa records are confidential under U.S. law. Therefore, the U.S. government cannot discuss the details of individual visa cases. Due to privacy reasons, the U.S. government also does not comment on medical information of individual travelers as it relates to the tennis player.
Yeah, I mean, we've talked about this so many times on the show now, because it's just, and you agree, I think, that it's just so hard to defend this policy.
And so I agree that the policy that requires athletes to be, or anybody really, to be vaccinated coming into the country when there are diminishing returns for what that means for the community spread don't make sense. But I do think there's a bit of a false equivalency being drawn here. So for one, back in the spring, the Biden administration started vaccinating migrants at the border. So you can come in, but at some point while you're being detained and processed, you are asked to be vaccinated. Otherwise, you are continued to be held, et cetera. And people have objected to that, but that is something that the Biden administration started doing. But I also think there's a difference, I'm sorry, between someone who is seeking asylum and someone who is coming for kind of more frivolous personal reasons. Like, I obviously think tennis is very important, but we have an asylum policy that's not about an immigration policy. It's the idea that America is supposed to be the home of the free, and people who are fleeing political persecution, who are fleeing violence, rape, attack for being gay, all these other kinds of things. There are a lot of reasons why you can claim asylum at the nation's border. And that is not something that is criminalized. It's something that we have really stood for as a country. Now, you have to prove your case. There is a very rigorous process to prove that you have a legitimate asylum claim. I worked on one of these cases pro bono when I was an attorney, and it's very, very hard to do. However, the idea that you should, as a contingent, your claim should be contingent on you first getting a shot, I think is a little. It undermines the values that we've set forth as a society. Now, after you win, whether you're required to get vaccinated, I'm not sure what the status of that is right now. But I think, yeah, it would be inconsistent if you can win an asylum claim and then come into the country in a way that random non-American migrants aren't able to do, or visitors aren't able to do.
Well, I support reforming our immigration laws, no doubt. But we should reform our immigration laws, and we should bring our whether you can come into the country or not if you've been vaccinated policies in line with all of our peer nations at this time, which don't do these strict kind of things. All right, that does it for us today. We'll be back tomorrow with the big news of the day and some very special guests. I joined your podcast, actually, Bad Faith, to talk about COVID stuff. Y'all should check that out. It was a
real pleasure. It's nice to talk to you in long form, Robby.
She's saying that through, did you have your fingers crossed behind your back?
No, he's even more charming outside of the little 10, 15-minute snippets.
Why, thank you.
But be sure to like, share, and subscribe to this podcast so you never miss any content. And for those of you who like to listen while on the go, we are now available anywhere you listen to podcasts.
See you later.
Bye-bye.